So this isn't a full treatment, but I'm just going to do a little palpation. And I would say there's tension on the right adductors more so than the left. All right, so that's nice. It gives nicely, it's pliable, whereas right here there's a little resistance right there. Okay, good. Now, because I want to show a specific element of compensation, I need to make sure that we have something here. All right, let's have you lift your leg to the ceiling. Good. Lift to the ceiling. And lift. Okay, good. And press in here. In. Good. Relax. And lift to the ceiling. Oh, there we are. Lift. And lift. All right. And let's see. Okay. Let me do this. I have to move quickly. I'm releasing the piriformis and the adductors. Remember, piriformis and adductors. Okay, and lift up again. Good. Lift up and lift up. Good. Okay, there's some ankle stuff going on too. Okay, so initially it seemed to test pretty well, right? However, because of the gait anomaly I saw, I wanted to make sure. So I activated here, which activates the adductors and the piriformis together, right? We did this test earlier. Mm-hmm. So they activated, then they relaxed, then they retested the hip flexors, and then we had a positive test. Okay, so that means that the adductors and the piriformis were compensating for the hip flexors. This is where we combine functional synergists with synergists to accomplish a compensation. So it's a two-stage compensation, right? So motor control will laterally rotate the hip a little bit to bring the adductors a little bit more forward in front of the femur to make them primary hip flexors, because the true primaries aren't able to do their normal workload, right? So you'll see a hip rotation and a recruitment of one of the other hip muscles, in this case adductors. So it's the lateral rotators and the adductors working together to substitute the adductors for the hip flexors. And that's why I need to release both the piriformis and the adductors during the relearning phase, and then retest so motor control could learn kinesthetically that, well, I don't need to tighten my piriformis or my hip adductors to flex my hip now. I can use my other tissues, which we know as psoas iliacus and rectus femoris. That was a good example of a functional synergist and a synergist working together, because truly the adductors some of the adductor fibers truly do assist hip flexion, right? But to really get them in position to do a good job of hip flexion, laterally rotating the hip really helps.